and YouTube, and on KSJE every afternoon at 5:06.
Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning, everybody.
I got it.
You got it. You did. Thank you. You've been practicing. You were practicing
in the
all
mirror.
night. Yes. Good.
Good morning, everybody.
Good.
Hey, I like this tie.
Do you?
Yeah.
Oh, thanks.
It's like a cross between like a picnic table and MC Escher.
Yeah, that's what I was going for. So thank you.
If MC Escher did a
Thanks for
picnic
that.
tablecloth
Shall we critique
pattern.
your outfit today?
No, this, I know. I think I forgot where I was going today.
Yeah, thanks.
But I mean, radio, Talking Heads.
Uh-huh.
Also, they have a song called "Road to Nowhere."
Yes.
And that's been my theme song this whole COVID time. We're on a road to nowhere.
Where are we going? Who
We're
knows?
on a road. Yeah.
Yeah. Okay. Well, thanks for that.
5 of 5 stars, I recommend. Yeah.
There you go. Well,
Cool.
perfect. It is Thursday, June the 11th, and we're glad that you are with us, everybody, for our COVID-19 local information program. We're going to talk to one of the doctors today from Urgent Care is
Yes.
on the show. We're also going to be talking a little bit about some of the changes to the gyms that have now reopened.
Yes.
The HHPC being one of them here at San Juan College that opened up on Monday. So we're going to get an update on that, and then sharing, as usual, our information and witty banter.
Yeah.
We've already done
We already
that.
started with the witty banter.
We did. But I wanted to also share next week the testing schedule
Yes, that's
from the
important.
State Department of Health. They have sent that over,
That's
and the
an update.
time has changed. So I think that's important for everyone to know. So as everyone knows, for the last at least couple of weeks, they've been doing tests Monday through Thursday. 3 weeks?
3 weeks.
Okay. Monday and Wednesday in Kirtland at the Judy Nelson School, and then Tuesdays and Thursdays here at San Juan College. And it's
Yes.
free COVID-19 testing for basically anybody that wants it. It originally started with essential workers, and it's expanded.
Right,
since
now it's
then.
whoever.
Right. But they started at 7, and now it's moving to 6 p.m.
Right.
And so it's kind of that first come, first serve, arrive by 6 p.m. for all drive-up events. So I think, obviously, you want to maybe get here a little bit earlier. But
For sure.
maybe for
No
folks-
appointments.
No appointments. You just
Bring your cell phone.
it's in your car, and bring your cell phone, and that's how they register you.
Right, so
and
it's
can alert
more
you to
distance, yeah.
the results, I guess, when they're ready.
Well, that and just as the public health department told us, it's also to avoid everybody touching the same clipboard, basically.
Yeah, sure.
Yeah. So,
just
wise.
that makes sense. But anyway, we wanted to share that with everybody that the time has changed. So don't come at 7 a.m. anymore, because you'll be excited that there's no line until you realize why there's no
You
line,
realize there's-
because it's at 6 p.m.
And you'll just see us, basically.
Yeah, pretty
Although
much.
the campus is slowly reopening.
It is. Phase 1 reopening of the college began this week. So
Hence the HHP.
HHPC.
That's right.
Health and Human Performance Center reopened on Monday.
I should just
okay.
let go of the acronyms and always just
Yeah.
say it
Yeah, there you go.
fully.
That's fine.
Yeah.
So, but there you are. And you're never here at 7 a.m. I don't know what you mentioned that, but never. I've never seen you here at 7 a.m.
Not here.
No.
No.
Okay. So they won't see you. They might
won't-
see me.
That's right.
But not you.
Well, it depends on how long the test takes.
At 7 a.m. when there is no testing.
Okay,
Yeah.
right,
Yeah.
because this coming week it
It's
has
at
been
6
moved to
p.m.
6 p.m.
That's exactly right. There you are.
See?
See? She's got it, everybody. Okay.
I'm back. It's because
She-
I only had fruit snacks this morning for breakfast.
Yeah, it's the most important meal of the day.
I know it's clearly a rough morning. I don't
Yeah.
but it's made with real fruit apparently. So
But you got my name right, so you're all good.
yeah,
No problem. No problem at all. So,
cool.
all right, there you go. Numbers, we can look
Yes,
briefly
let's do that.
at the numbers. Again, we're going to ksje.com, and in our news section, you can kind of check it out, everybody, and see what we've got up online. But there they are from the State Health Department, of course, and we're sharing those. And there's the latest numbers coming up. We're at 9,250 in New Mexico for a total of 147 new cases reported yesterday. We had 34 more in San Juan County. For now, we're above 2,000 in the county. There were 6 deaths across New Mexico, so that's above 400. And of those, 2 were in the county, and the recoveries were up by 107. So,
That's good news.
So that number keeps growing as well, which
It
is good news to
does.
see.
Yes.
So we're excited about that. If we scroll up a little bit, scroll down a little bit, we can see the Navajo Nation numbers as well that came in. And that's the same graph I showed yesterday, so I'm not going to show that again. But the numbers are different. They're at 6275, 125 more cases across the reservation yesterday with 292 deaths. That's an increase of 7.
Okay, right.
So that's
Cool.
where those are coming from. But anyway, more information, again, at ksje.com, and you can see the story there about San Juan College, too, about what's happening.
Yeah, what's open?
Right. HHPC, the bookstore has reopened, will reopen, next week, June 15th, at 25% capacity. The virtual graduation is planned for June 30th.
Great.
So there's all that
That's
happening up
yep.
here. So there we are.
There we are.
Yeah. So we want to go to our first guest.
Sure.
Okay.
The doc.
The doc?
Yes.
All right. Let me find that and get that ready to go. We spoke with her yesterday afternoon. It's a pre-recorded interview, but great information from Dr. Sugar Singleton from San Juan Regional Medical Center. Joining us now to talk a little bit about her work at San Juan Health Partners Urgent Care, Dr. Sugar Singleton is joining us on the phone this morning. Dr. Singleton, good morning.
Good morning, Scott. Good morning, Megan. Thank you for having me.
Thank you for calling in. It's great to have you on the program to talk a little bit about how you are dealing with potentially COVID patients when they come to urgent care, and you've done some remodeling or changing things around over there. So let's start there and tell us what's new, please.
Well, we're always happy to be on your show, Scott. We're grateful to be able to communicate with the citizens of San Juan County. And, I'd like to tell you about some of the changes that have been happening at urgent care over the last few months. Of course, we are right in the middle of this COVID pandemic, and we have ramped the way that we see patients at urgent care. What we're doing and what we will continue to do is that anyone who comes into urgent care who has any kind of a respiratory complaint or anything that could be a potential COVID case, so for example, fever, cough, shortness of breath, sore throat, upper respiratory complaints, and body aches, headaches, those kind of things. Those patients are triaged over the phone from their car, and then a nurse will go out, take their vital signs, and then a doctor who's in full PPE will actually go out and see the patient in their car. We will give them a full assessment in their vehicle, and then make a decision how best to treat them, test them for COVID if that seems to be the appropriate thing to do, and then give them their treatments and their prescriptions onto the pharmacy, et cetera, where they need to be, and take care of them fully in their vehicle. And the reason that we're doing this, Scott, is number one, we want to keep the COVID patients separate from our normal population, and that leaves our clinic actually free, hopefully free from any kind of contaminants, any kind of COVID potential germs, and that keeps our client population safe, our patient population safe, and of course it keeps the rest of our medical staff safe because we want to make sure we're taking care of our staff and our patients. So that's the changes.
Very good. Thank you.
Speaking of changes, we know that this kind of blew up in the news this week, and the World Health Organization kind of backtracked, and so we always like to ask our local doctors to give us some insight into the developing news about the virus. And so on Monday, the World Health Organization released a headline about asymptomatic carriers being very rare, and then it got kind of complex when they started talking about that again. So we would like to hear what you have to say about that specifically.
Well, I don't think that in reading that, I don't think that that's exactly what they said. I do think that that's the way it was interpreted and discussed by the media in the news, but that is not exactly what they said, and it's not what was intended. I don't think, this is a new virus. We're learning new things literally on a daily basis, sometimes on an hourly basis, so we're getting new information constantly. There's researchers and epidemiologists and so many scientists all across the world that are working on this, that the vast amount of new information is just coming at us from every direction constantly. But in researching that, Megan, I don't think that that's what they intended. I don't think we know for sure, but I do think that we feel like that asymptomatic carriers can be a big source of transmission, and that we are seeing a lot of asymptomatic people, even in San Juan County. We're doing a lot of testing when we have a person come up positive for COVID. There's fortunately a good effort by the New Mexico Department of Health as well as San Juan Regional to test at least their close family members, their close contacts. And what we're seeing is that many of their close contacts, their family members, their household members are coming up positive, and yet they're totally asymptomatic. So we do know that people, we do know they are carriers, and we do believe that they are spreading the virus, which is one of the big reasons we want to continue to encourage people to social distance, continue following the governor's guidelines, continue wearing your masks. We are really, really grateful that we're seeing a trend down in the numbers finally, and we feel like this is because people have been diligent about following the governor's guidelines, staying home if they don't need to get out, wearing your mask, social distance, and it's paying off, Megan and Scott. We're seeing a trend down in the numbers, and I just want people to know you're doing a great job. Keep up the good work. Keep on doing what you're doing, and let's beat this virus.
Very good. Well, and Dr. Singleton, I think it's important for folks to hear you saying that that the information we're learning about this virus is changing daily, hourly, minute by minute almost in some cases. And so when we see these news stories and hear these news stories, I think it's important to maybe take them with a grain of salt, and this is a news guy saying that, because there is so much that we don't know about this virus because it is so new, so novel, and how it spreads and how we should be treating this. And we're learning new stuff every day, correct?
Absolutely, Scott. You said that perfectly.
All right. Well, thank you. And again, as we talk about reopening and as we get back to maybe a little bit more of our normal routines, again, you mentioned too that we need to still be very careful about all those things we've been talking about since March, right? The washing our hands, the not touching our face, now the wearing of the masks, because that is what appears to be helping to drive our numbers down in the county and in the state.
Yes, exactly. Most definitely. We strongly encourage that what everybody has been trying to do, keep doing it. It's working. Keep washing your hands often and frequently for at least 20 seconds. Don't touch your face. Keep your mask on, but try to keep your hands off of your face and hands off of your mask, and stay 6 foot away from people. If you are going to go out, maintain the social distancing. Wear your mask when you're out of your house, and continue doing what you've already been doing because it is working. One of the things that I do want to bring up, Scott, is that I think as things begin to reopen, that we want to encourage people that if you've been putting off something that you're concerned about medically, if you haven't taken your child or yourself in for routine medical care, or if you have a concern that you are worried about, but you've just been wanting to stay home because you're concerned about going in. A lot of the clinics in town have been closed, but as we start to open back up, I do want to encourage people that all of the clinics in town have done similar things to what we're doing in terms of rethinking their design, rethinking their cleaning, redoing things to make sure that the patient population is safe, and it is safe to go back in and see your doctors. It's safe for you to come into urgent care. We will maintain the separation between anybody who could be a potential COVID patient versus people who are coming in for other things. So we want to encourage people that it is safe to go back in and see your doctor. It's safe to go back into the medical homes in the community. And if you have concerns, don't wait any longer, because we're worried that people have been concerned and they're staying home because that's what we've advised, and we are grateful for that. But now if people have concerns that they've been putting off, it's time to get back in and see your doctor and take care of those things.
Very good. And so kind of switching gears a bit, although keeping in line with the new information developing, I do have a question about this multi-inflammatory syndrome in children that we're hearing a bit about now, where kids are testing positive for antibodies but not COVID, but it's disrupting their system. Can you speak to that a bit?
I can't speak to it very specifically. I think Dr. Harrington or one of the pediatricians would be better and more knowledgeable about that. What I can say is what we've been saying already is that this is extremely new. It's very, very worrisome. We have, as far as I know, had at least one case in New Mexico. Most of the cases early on were on the East Coast. And what I know is that the scientists and the doctors around the world are really working on this because it is so concerning. Initially we felt like the children from this, it was more of a disease that was much more impactful on our elderly and geriatric populations. But now that we're seeing this new syndrome in the kids, of course, that is right on the forefront of everybody's concern.
Right. Thank you, Dr. Singleton. And again, it goes to show just how this information is changing and evolving daily, weekly, with some of these new changes, I guess. And we've heard that maybe the virus is mutating a bit as it develops and matures and things along that and moves through the population. So even that is stuff that folks in your line of work need to stay on top of, correct?
Right, absolutely.
Very good. Now, you mentioned a little bit about getting back into seeing our doctors if we have health issues, health concerns, and maybe folks have not been doing that since March, of course, because we were told to stay home and things along that line. Does it concern you that maybe folks that have some chronic health problems that have maybe been undiagnosed and haven't seen anyone in 3 months, that they could be having more serious problems if they don't get to see a doctor sooner than later?
Most definitely, Scott. I think that's our big concern across the community and even across the nation, for that matter. We're concerned with our population of people who have chronic medical problems, diabetes, high blood pressure, et cetera, and that it's important for those folks to be seeing their doctors regularly, maybe every 6 months. Some folks even more frequently than that. And because of what we've all been dealing with across the world with this pandemic, we've all been staying home and not getting the medical care that has been needed. And so, yes, if you have chronic medical conditions, it's time to get back in with your doctor, call and make an appointment. And for those other things, if you have concerns about something acute that's going on, we're happy to see urgent care. We are fully staffed. We are seeing patients every day, 7 days a week, 365 days a year, 9 a.m. until 8 p.m., and we are on the corner of Main Street and English Road, right across the street from the Animas Valley Mall, right by Target and Walmart. And we're happy to take care of folks for any of their needs. Of course, we're doing the COVID testing, but we're also taking care of everything else that people are concerned about.
Very good. And as you mentioned earlier, Dr. Singleton, you've got precautions in place for folks that they can stay in their car and get signed in, and then you guys can triage and figure out where that patient needs to go and who needs to see them, and they can do it maybe at the car until they need to be brought into the building, and all those different precautions, which is what we're dealing with these days.
Right, and I think that's what we're going to be dealing with for a while, Scott. It's going to kind of be our new norm, but I think the San Juan Regional has gone above and beyond to make sure that we're taking care of both our medical community, taking care of the nurses and our staff, and of course they are putting the patient needs and the patient safety first and foremost, and doing everything that needs to be done to keep our patients safe, keep our patients separate from any potential COVID patients, and we can to stay in our integrity, to take care of San Juan County and take care of all of our citizens.
There you go. Well, if we can watch a movie from our car, we can see a doctor from our car. That's my advice, though. My policy.
Well, it's kind of been interesting. I worry that people are going to get used to this level of service, and they're just going to want us to see them in their car from now on.
Right.
No, come on. Medicine is too much of a humane practice.
Right.
You got to get back to that.
That's true. But still face-to-face. So it's just
Yes.
in the parking lot. So there you
Absolutely.
go, to start. So
yeah,
perfect.
Yeah, they are getting a full evaluation by a physician or advanced practice provider like a nurse practitioner or a physician or a physician assistant,
Right.
which we have also in our clinic. But they're getting a full assessment by a provider, including a complete history and physical examination, et cetera, and assessment, even though it is in their car.
There you go. Well, that is how we do it. We're thinking outside the box in all of these professions. That's very true. So wonderful. Well, Dr. Sugar Singleton, we appreciate your time this morning. And again, San Juan Health Partners Urgent Care, as you mentioned, the time, the hours, you're open for business. And folks, again, if they hadn't been seeing their doctors or taking care of their medical needs, now's the time to maybe reconnect.
Yes, absolutely. Get in to see your doctor, and we're happy to take care of you. Urgent Care, come and see us. And Scott and Megan, thanks for having me on. Appreciate you guys, and thanks for what you do.
Thank
you for what you do, and your colleagues as well. Thank you very much. That is Dr. Sugar Singleton from San Juan Health Partners Urgent Care with us today on KSJE. More good local information. We're back here in the studio. Scott Micklin along with Megan Cullop, and great info.
Great info, as
Right.
usual. Always fun to hear from our docs.
Yes,
Yeah,
all of them.
all of them.
I know.
We love them all.
We do, equally.
We do love them all equally. We have high regard across the board.
We do, and we appreciate San Juan Regional Medical Center making them available to us whenever we ask. I mean, it's not like they're not busy or anything these days, so we appreciate them taking 10, 15 minutes out of their day to talk to us. So
shout out to Roberta for that, right? She's the
Roberta
booker.
Rogers, and
Yes.
yes, exactly. So appreciate it.
Yes.
All the folks over there.
Thank
So,
you.
Thank you very much. So coming up, we're going to hopefully talk to San Juan College in just a moment about what they're doing over at the
gym.
HHPC. And, of course, other gyms have opened up, too, this week with the new restrictions, wherever phase we're in, 1?
We're in phase 1.
1A, whatever it is, across
think
the
just one.
state. and so that's important, I think, to explain what the
What does that
changes
mean?
are.
If I go to the gym, what does that look like?
Right.
Right. Because I'm of the camp of like, we don't live in fear, but we live with prudence and caution. And so it's helpful for people like me to hear what's going on out there. How are you guys preparing for more people coming in and stuff like that? So hopefully that's helpful information to all of our gym rats out there.
Exactly.
Do you go to the gym, Scott?
I visited the gym. Does that count?
I've visited the gym on like the open houses where they have free food.
Of course.
Yeah.
That's what gets me in the door.
Yeah.
That's right.
They have pizza today.
Yeah.
I'm heading over to the gym.
I'm there. That's right. Exactly. So, no, I'm not a regular gym goer.
Yeah, no, there's so much free public
Just
land.
look at me, and you can
that's
probably
what I
figure that
use.
out. But yeah, that's true. But,
Too hard on yourself.
thank you. But what are the national numbers looking like this morning?
This morning. So again, this comes from the Johns Hopkins University COVID-19 dashboard. And so as of Wednesday night, we are almost at 2 million cases, 1,999 cases of COVID-19 reported in the U.S., an increase of 14,230 from yesterday. That's actually lower than we've seen.
Okay.
The lowest we had seen before that was 15,000. So, and that's good news. And then deaths, 112,895 deaths. And so they've been keen on making this point that the mortality rate among confirmed cases is 5.7% due to like the actual numbers that they have right now. But they're always adding this disclaimer that the true mortality rate is likely much lower, between 0.4% and 1.4%, but it's impossible to determine how precise that is because of incomplete testing. So we still don't have enough tests, I think, is the ultimate takeaway there.
But they are ramping up. I mean, all across the country, we're seeing more and more tests.
For
In fact,
example.
even here at,
Even here.
6 p.m. next week, everybody.
6 p.m.
so make
next
sure you
week.
get that. But
That's
anyway, I think we're ready to go to our
Let's
next
do it.
guest. So let's bring them on the air this morning. Good morning. You're on KSJE.
Good morning.
Hello. Is this John?
Yeah, how are you?
I am good. John Betts from San Juan College. Thank you for calling in. And by the way, congratulations, because this is a new job for you as director of the HHPC.
Exciting time, and it's a difficult time. But yeah, it's great to be back at the HHPC, and I'm happy to talk with you folks this morning.
Appreciate it. Well, as we mentioned, John, we wanted to kind of just everyone understand how you've been able to reopen the Health and Human Performance Center, and I think not everything has reopened, but you've done it safely. And what can folks expect if they want to get back into the habit of going to the gym every day? What have you guys been able to do to allow you to reopen this week?
Okay. First of all, we've been following the state health orders from the governor. And that was our first opportunity to get moving forward. I believe it was May 28th, the governor announced that gyms and fitness facilities would be able to reopen at 50% capacity with some restrictions tied on to that. And so, once again, safety is probably the most important factor in reopening, and that's what we're emphasizing here at San Juan College and the HHPC. And in that vein, we're following the New Mexico Health Department's COVID-safe practices for employers and gym and fitness facilities. And some of those requirements, you can go onto the New Mexico Department of Health website and see those. They're called CSPs, COVID-safe practices. But it's some of the things that you've been hearing on the news and the media for several months now, the importance of social distancing or physical distancing, how important it is to wear a mask, the importance of washing your hands continuously throughout the day, and after each time you touch something, a surface or something that might be contaminated, so washing hands is very important. And then also just the increased sanitation and cleaning of the equipment that's being used. We already had a very stringent cleaning and sanitizing program, but that's been beefed up. And we have people that are there on premises just to primarily clean the equipment prior to use by a member or after use. Other things we're doing is traffic control. We have a one-way traffic system. You can only enter through one door of the HHPC, and you have to exit through an opposite door, so we don't have any close contact there. We have a lot of signage up reminding people of the importance of social distancing. One of the biggest questions we get is in regards to a fitness facility is wearing a mask. And we just require our members to wear a mask when they come on campus and desire to enter the HHPC. Once they gain entry and begin to exercise, they're not required to wear the mask while they're actually exercising. So I wanted to kind of clear that up. We do ask members, though, that if they're going to take a break or go to the restroom or something, that they do put their mask on when they're in the primary hallway. Other things that we've done, we're following COVID-safe practices in regards to all employees are being checked prior to being allowed to start their shift. We are doing a temperature check, which follows both CDC and New Mexico health guidelines. We're also asking, the symptoms survey is what I call it, but questions in regards to are you experiencing any symptoms, and also what your potential contact has been with people that might have COVID or potentially have COVID. So we have a lot of safety measures up, a lot of signage. Our staff was trained on how to use personal protective equipment, PPE. There's a proper way to put on a mask and take off a mask. There's a proper way to put on the gloves. So all the staff are trained in those areas, but I think we're off to a good start, and we're really excited. I'm anticipating another press conference from the governor probably today or tomorrow, and we'll see how things go from there.
Makes sense. Well, those are helpful safety precautions put into place. I have a couple more questions regarding the safety bit. One is, one of the most popular things at the Health and Human Performance Center is the rock wall. So, is the rock wall open yet?
No, the climbing wall is not open, and if you can just imagine, I've only been in the position a few weeks, but I don't know how many handholds they have on that climbing wall. And for us to be able to sanitize and keep the climbing wall itself clean, is just would be a difficult thing for us to do. Also, you know, a lot of our people that use the climbing wall are using our rental equipment, ropes, carabiners, all those types of things. And so keeping those clean and sanitized, we thought that was a little much right now. And so we've decided not to open the climbing wall.
That makes total sense to me. Also, another sanitation question. When it comes to distance between machines, I only ask because there's the 6 feet apart physical distancing thing, but then they've been talking about how people who are exercising and sort of, you know, are huffing and puffing a bit might be, those swirling droplets might go further than 6 feet. I know Scott's making a cringe face. He hates that term.
I do.
But that's what they say.
It
so
is.
How far apart are the machines these days?
Well, I can assure you that they're all at least 6 feet apart, if not more. I'm going to say most of our machines are about 8 feet apart. And I'm speaking a lot, mostly about the cardio equipment. But we've actually relocated probably 40% of the equipment that was in the fitness center. And we now have it staged and located out in the hallway where people can use it and still manage their social distancing. And so our staff has done a lot of great work. Carlton Downey, Chris Sharp, Roman McCabe, Maureen Drake, and Ellie Meyer. They've done a lot of work to get us where we are today. And I just think people, if they come up and take a chance, just to come up and look around to see what we've done, I think they'll appreciate it and have a little bit more interest in coming back.
I bet they will. Well, I know a lot of folks have been talking about the quarantine 15, so we need to work that off, John Betts, so we can do that at the HHPC. You are only open at somewhat less than your regular capacity, though, right? You have to follow those state guidelines, correct?
Yes, sir. And so, you know, it was 50% capacity, and it's funny, I can't tell you how many questions I received about what is 50% capacity. And so, you know, we started with basically fire code capacity and those types of things, and then you have to go backwards. But, you know, Carlton Downey did a lot of work, and we came up with basically that our maximum capacity for the whole activity wing is 135 members. So with staff, we're looking at about 150 people. We've also broken it down into specific numbers of people in particular areas. You know, the fitness conditioning center, the weight room, if you want to call it, is the most popular. And we've set that at 50 people. The gym is set at about 48. And I know a lot of our pickleball players are interested if pickleball is open, and it is. And we've had some questions about that, so I'll just address that. Pickleball is being allowed is because there's only 4 people together at one time. And they are exercising, but they're at some distance most of the time while they're playing the game. So we've done some research and felt that pickleball was okay to open. But the gym can hold 48 people. The open area in the hallway, we've estimated at 20. The mezzanine at 5. The jogging track at 12. And then our aerobics room and group exercise classes are all closed or shut down right now. That is an order from the governor, no group exercise. So the aerobics room, dance room, the boxing room, the climbing wall, and the challenge course are all closed at this time. The rental center is open. They're renting out just watercraft once again. It comes down to how you can sanitize things and have them ready for the next customer. So that's pretty tough to clean camping equipment, a tent, or a sleeping bag. And so right now, the rental center's just renting out watercraft and those accessories. And so they have a very rigid process as well. They prefer orders online now through the website, those types of things. So everybody's doing their part to ensure the social distancing and follow the CSP rules.
Very good. That makes sense. And another question for you. What about hours? Do you guys have limited hours now, or what are your hours?
That's one thing. We did change our hours. Normally we're open from 4:30 in the morning till 9 at night, Monday through Thursday, and then Friday was a little shorter. But yeah, we've changed our hours. A couple reasons for that. One, we're doing additional cleaning prior to opening each morning. So we open at 6. and we close at 7 p.m. Monday through Fridays. And then Saturday is still 6:30 to 5 p.m., and we're closed on Sundays. But once again, the hours were changed on both sides, the opening and closing. As I said, we do staff come in early and do a cleaning before we open in the morning, and then they also do a deep cleaning after we close at 7 o'clock. And then in addition to that, custodial crews come in at night and also do additional cleaning and sanitizing. So it's a good system.
Very good. Well, John Betts, we appreciate your time this morning to talk to us a little bit about the changes that you and your staff have done to enable yourselves to reopen the HHPC and to let us all go back in there and get rid of some of these extra pounds we've been putting on. So it's good to hear from you. Thanks so much.
Thanks so much for the opportunity. And if there's any questions, people can call the HHPC at 566. Let me get down there. I got to remember my new phone numbers, 566-3410. Or they can email us at hhpc@sanjuancollege.edu.
There you go. All right, we will do it. John, thanks again. Take care.
Thanks, Scott. Appreciate the time.
You bet. That's John Betts, everyone. He is the new director of the San Juan College Health and Human Performance Center, speaking with us on KSJE. So,
Good info.
Lots to talk about, for sure, right?
That's right. So
and lots to do it safely to be able to reopen.
Exactly.
So
What was
I
gonna
interrupted
say?
you. I'm sorry.
Well, it was just an aside.
Oh.
Like our new hours start at 6, but the original hours
The 4:30?
Were,
You
I
had a
was
problem
like,
with that?
whoa. Well, the only way I'd ever make it to a gym at 4:30 is if I was working a night shift somewhere else.
Well,
like
that's
I'd have to be
probably why they
going
were open
after
at 4:30.
work.
Sure.
As opposed to 4.
Right. Understood. But there were people there.
I guess so. There must be.
Yeah. Even today.
Were you going to say I can confirm?
Well, I can.
Have you walked into a gym
when
at 4:30?
When I would come on campus about maybe 6:30.
Yes. That's a popular time, though.
There was a busy,
that makes
it was a busy parking lot. So I think if folks get back into their habits of
That's right.
of going to the gym, we'll see those numbers increase.
It's time.
But yeah,
It's time to halt the sloth.
Okay,
Not like sloth.
I get
but,
you. All right. Yeah, be more active.
That's right.
That's what you're saying.
That's what I'm saying.
I understand. Okay, very good. If folks want to call in with a final thought about the show, the week, the pandemic, we've opened the phone lines.
That's right.
566-3909, everybody, 566-3909, if you want to give us a call and let us know how you are surviving.
Faring.
Yeah, faring. Are you going back to the gym? Are you not
gonna
going back
play
to the
some
gym?
Pickleball? Pickleball is so popular in this town.
It is very popular,
really
right?
is.
I have not ever played pickleball.
Me neither.
Yeah.
But as an encore instructor, I know that the pickleball class, which I do not teach, fills up so fast.
It does.
Yeah.
Very true.
It's like wait list type situation.
Exactly.
It's crazy.
Go
It must be
figure.
fun. I don't know.
I think it probably is.
It must be gentle on the
Even
body.
the name is fun.
I know.
Pickleball.
I bet you
So-
just imagine eating a pickle in one hand and then just
I'm just
imagining
imagining.
underhanding a ball.
I'm imagining a giant gherkin and hitting it with a bat.
Gherkin.
Yeah. Thank you.
Facebook, spell that.
There you go.
Facebook users, spell that.
That's right. Anyway, well, it's been a great week,
It's been a great week.
and we appreciate everyone joining us for our local information program right here on KSJE. And of course, we'll be back on Monday. Again, our plans are to talk again with San Juan Regional CEO Jeff Bourgeois to get an update on what's going on there. We're seeing our neighboring state of Arizona; their hospitals are getting concerned about their capacities.
Yes.
Because of their increases in
Yes,
in
Arizona.
cases, and so that's for them to worry about, obviously. But obviously, we're concerned because
We're close.
we're a neighbor. So I think our facilities are still doing very well in our state, which we're grateful for. So we'll be back on Monday, everybody, at 9 a.m. live on Facebook and YouTube. Of course, you can hear us at noon on KNMI Vertical Radio 88.9, and again here at KSJE every afternoon at 5:06 p.m. with our local information program. But stay safe and stay well, and have a great weekend. We'll see you back here on Monday. Bye-bye.